Hello, everyone, and a huge welcome from all of us here at Pekes. We're so glad you could join us for this really important workshop. So, today we're diving into a topic that, let's be honest, is on every parent's mind at some point: bumps, breaks, and little bones. This is all about giving you the confidence to handle those inevitable tumbles that are just part of growing up. So, a special welcome to all our Pekes parents, and of course, a big hello to all parents and carers watching along. It's just fantastic to have you with us. Our goal today is pretty straightforward, but it's so important. This whole workshop is designed to help you get your head around those common childhood injuries, learn to spot the warning signs that really matter, and feel confident that you know how to respond to keep your little ones safe. Okay, so here's what we've got on the cards. First, we'll look at why little bones are so different. Then we'll cover common injuries, what signs to watch for, and crucially, when to get help. And we'll wrap up with your role as a carer in it all. Sound good? Let's get started. Right, let's jump straight in. Section 1, why little bones are different. Understanding the unique way a child's body works is the foundation for everything else. Once you get the why, knowing what to do becomes so much easier. Okay, so this is the absolute key takeaway. A child's bone is not just a miniature adult bone. They're fundamentally different. They're much, much softer and way more flexible. That means they're more likely to bend or have a little crack, whereas an adult bone, which is harder and more brittle, just tends to snap. And here's something else that's unique to children: growth plates. Have you heard of them? They're basically these areas of soft developing tissue right at the ends of their long bones. Think of them as the engine rooms for growth. They will allow your child to get taller, but they're also something we need to be mindful of when we think about injuries. Section 2, common injuries. Okay, so we know how their bones are different. Now let's look at the kinds of injuries that can happen because of that. You can think of this next bit as your field guide to the bumps, bends, and breaks of a totally normal, active childhood. And it's so important to remember these tumbles are just part of them exploring their world, right? You've probably heard this term before, a greenstick fracture. It's one of the most common breaks we see in young children, and the name is actually a brilliant clue. Because their bones are so soft and flexible, the bone literally bends and cracks just on one side. It doesn't snap all the way through, and this diagram shows it perfectly. I want you to imagine taking a fresh green twig from a tree. If you try to snap it, what happens? It bends and it cracks on the outside. But it doesn't break clean in two, does it? Well, a child's bone does exactly the same thing. And this is so important because it means a child with a greenstick fracture might still be able to move their arm or leg a bit. That can be really misleading, so please don't assume it's not broken just because they can still use it a little. Okay, next up is something we see a lot, especially in toddlers: the pulled elbow. This usually happens to kids between 1 and 4. It's when a little ligament in their elbow slips out of place, often after a sudden pull on their arm. The absolute classic sign is that the child just stops using that arm. They won't bend it, they'll just hold it quite straight by their side and refuse to use it for anything. Now, the brilliant news is that this is almost entirely preventable. It's so simple. There are just 2 golden rules. 1, always lift your child from under their arms, supporting their chest. And 2, try to avoid lifting or swinging them by their hands or lower arms. I know it's so tempting when you're playing, but it can make all the difference. And of course, we've got to remember not every tumble ends in a break. More often than not, it's what we call a soft tissue injury. So that's things like sprains and strains, where it's the muscles and ligaments that are hurt, not the bone itself. You'll still get pain, you'll still get bruising and swelling, but these tend to heal up nicely with a bit of rest. And that actually leads us perfectly into our next section. Section 3, what signs to watch for? Look, our little ones can't always point and say, "Mummy, my wrist really hurts right here." So, you have to put on your detective hat. Honestly, learning to read their behaviour is probably the most powerful tool you have. So any change from their normal behaviour is your biggest clue. Ask yourself, are they suddenly not using an arm? Are they refusing to put weight on a leg? Have they all of a sudden got a limp? Maybe your right-handed toddler has suddenly started doing everything with their left hand. Those kinds of changes, along with the more obvious physical signs like swelling, bruising, or even redness or warmth, are all signals to really pay close attention. Section 4, when to get help. Okay, So you've spotted a few signs, you're paying close attention. Now what? What do you do next? Well, this next section is all about turning that observation into action. It's about helping you make confident decisions on when it's time to get some proper medical advice. Think of this as your go-to checklist. It's always, always better to be safe than sorry. So get it checked out if you see any of these. If your child is just flat out refusing to use an arm or a leg, if they've suddenly started limping, or if they just can't or won't stand up or walk, it's time to call someone. The same goes for any really noticeable swelling, or if they're still complaining about pain even a little while after it happened. Okay, now for a really important one, I want you to just pause for a second and file this question away in your mind, because in that stressful moment, this is your key mental check. After a fall, just take a breath, have a look, and ask yourself this. Does the arm or leg look well, misshapen? Is it at a funny angle? Does it look obviously different to the other side? Right, and if the answer to that question is yes, then the advice is crystal clear. It's non-negotiable. This needs immediate urgent medical care. Don't hesitate, don't wait and see, go straight away. Section 5, your role as a carer. Okay, so let's move on to our final section. No matter what's happened, whether you're waiting for an ambulance or just dealing with a minor bump at home, your role as their parent or carer is absolutely vital. This is your toolkit for the moment an injury happens. It's all about what you can do to keep your child safe and, just as importantly, calm. Remember, your response sets the entire tone for them. So rule number 1, and this is the hardest one I know, stay calm, or at least pretend to be. Reassure your child, because your calm is contagious. Next, just let them get comfortable, whatever that looks like for them. Try not to move the injured bit and just keep observing them. Keep an eye on how they're behaving, and then, using everything we've talked about, you can make that call to seek help if you need to. You are their absolute safe space in that moment. And really, that just brings us right back to the heart of it all. This quote says everything, doesn't it? It is our responsibility as adults to keep children safe. By just being here, by taking this time to learn today, you are doing exactly that. You're stepping up to that responsibility. And on that note, thank you very much for watching. We really hope you found this helpful and that you're leaving feeling that little bit more confident and empowered. From every single one of us here at Peques, thank you and have a lovely day.